Hello, I'm Catherine West, Infection Control Consultant, and thank you for joining me today for another segment of Let's Get It Straight. Our topic of today is pertussis, whooping cough, an important one because it's being overlooked, and we need to get some good information out there for everyone. So the need to get information out there. Here's the reality. Pertussis, not Marburg, Lassa Fever, or Ebola, should be the current concern. We have things in place to deal with that. We are not addressing the topic of pertussis, and our case rates should raise and ring an alarm bell. The highest case numbers in the United States have been reported in New Jersey, New York City, Texas, and Pennsylvania. If we look at the numbers in Texas and Pennsylvania, you will see that the confirmed case number for Texas is 772 cases for thus far in 2024. Compared to just 264 reported last year. Pennsylvania reported about 10%, over 2,000 cases of pertussis thus far for 2024. Overall, our case number for 2024 totals 14,569 cases, 4 times higher than the number in 2023, which came up to 3,475 cases. The reason for the increase is twofold. We have our anti-vaxxer group. They have been around for quite some time. But there's a new group called vaccine hesitancy. This has come about because of confusion, mixed messages, misinformation, and general distrust of information being brought forward on safety and efficacy of vaccines. Pertussis is caused by a bacteria, and the bacteria is called Bordetella pertussis. Now, this bacteria is known to frequently change In discussing why talking about pertussis at this point of time is so important, is just look at the greatest risk group who might contract this disease. And it's infants under 1 year of age, because they have not yet reached the age where they could receive preventative vaccine. So this is where we're seeing the highest rate of illness. Additional persons at risk would include women in their 3rd trimester, as well as persons with pre-existing health conditions, such as moderate to severe asthma, or individuals who may be immunocompromised. The incubation period for pertussis is usually 5 to 10 days following an exposure event, but some symptoms may develop up to 3 weeks after the exposure. This is an illness that is considered to be highly contagious. Transmission, direct contact with respiratory secretions, and these are large droplets. That puts this illness in the category of a droplet transmitted disease. Pertussis starts and goes through 3 stages. In stage 1 is usually 1 to 2 weeks of infection and begins with fever and coryza, which is that very thick drainage that kind of sits below the nostrils and on the upper lip. They will also present with a non-productive cough. This is the time where they are highly contagious. And remember, these symptoms can be symptoms of other respiratory illnesses as well. In stage 2 of the illness, this is when coughing spasms begin. And the force of the coughing can be so strong that some young children, for example, develop black eyes and fractured ribs. This period can last 1 to 6 weeks and is characterized by the whoop sound. When the individual is finally able to take a breath, that is when we hear the traditional whoop sound. Now, if you've never heard this sound, you can Google it, and I have done that. I had to play it about 3 times, but I found it to be very helpful. The next thing in this stage is that vomiting will occur. So, for prevention and transport of a child suspect for or known to have pertussis, we want to put a surgical mask on the patient. Now, because of coughing, patient may not be able to tolerate a mask. In that case, you, the care provider, would wear a surgical mask. When transporting individuals who may have an airborne, or in this case, droplet-transmitted disease, don't forget about the built-in protections of your vehicle. You can put the heating or air conditioning on the non-recirculating cycle. Don't forget about turning on the rear exhaust fan. Remember that this fan exchanges out all of the air in the back of your vehicle. It is not recycled. It's vented directly to the outside of your vehicle, a built-in protection. Stage 3 of this illness is generally referred to as the convalescent phase. This can last as long as 2 to 3 weeks. And during this time, we see gradual recovery, improving cough, and fewer coughing spasms. How do we diagnose pertussis? A culture is considered the gold standard for diagnosis. Cultures, as you know, can take a couple days to grow out. Other tests that can be performed include polymerase chain reaction, PCR, or serology. So what about prevention? In addition to what our vehicle offers us. As the cases of pertussis continue to rise in the United States, it is really important that we ensure that our healthcare workers are protected. It was back in 2005 that the Centers for Disease Control and Prevention stated that all healthcare workers needed an additional dose to protect against pertussis. You know, the last time most of us received protection for pertussis we were either 11 or 14 years old. And it appears that over time, we have lost our protection. So that then brings up the question, how long are we protected if we take our Tdap booster? Well, we know that antibody protection begins to decline after 1 year, and that protection wanes 2 to 4 years after receiving your vaccine. So Tdap is recommended to be given at 12 years of age. And then again, in 2005, all employers of healthcare workers were put on notice that they were to offer free of charge Tdap booster to protect healthcare workers. So as I mentioned, since 2005, the Advisory Committee on Immunization Practices, an independent group that makes recommendations to the CDC, stated that we all needed that single dose of Tdap for protection. And part of the goal not only is to protect healthcare workers, but also to protect household family members, co-workers, and the patients we see in our community. In looking at hospital-based Tdap coverage rates among healthcare personnel, it seemed to depend on the type of vaccination program that each institution put in place. And coverage ranged from 30% to 100%. Of course, that's in hospitals that mandated Pertussis vaccine. Nationally, Tdap coverage among healthcare personnel is only 42.1%. This is an example of what can occur when one person with pertussis comes to work. Now, this was back in 2010 at the Cleveland Clinic Children's Hospital. A healthcare worker did not receive their recommended booster. The individual signed a declination form. After that, this individual worked 22 days with history of a cough that was barky and very atypical. Healthcare worker was then diagnosed as having pertussis. Contact follow-up for this case revealed that 23 pediatric patients on the hematology oncology unit were exposed, as well as 31 other infants and 92 coworkers. The cost for just doing contact follow-up was over $12,000 because this individual declined the $30 preventative vaccine. Now, a couple of issues here. Number one, the Cleveland Clinic admitted that they didn't follow up individuals who signed declination forms, and perhaps it would have been advisable in that case to move her to a different unit. I mean, here she was working with very at-risk immunocompromised children. The second issue here is, how was this person permitted to work for 22 days with this horrible cough without someone saying, you need to get medically evaluated? Now, I believe that the cost of $12,000 for contact follow-up was certainly not the end of the cost to the Cleveland Clinic. I'm sure that the legal cases followed. So back in 2005 and published again in 2011 was a call for all healthcare personnel, especially those involved in the care of children, to get a one-time booster dose. This also included recommendation that all child care providers get the additional dose. So if you have children in daycare, even private daycare, you want to make sure that they have been boosted. Parents of young children are being boosted. Pregnant women are being boosted with every pregnancy. And grandparents, even over the age of 64, are also being strongly advised to get vaccine. Vaccine is reported to be 90% effective. Well, what was it like before we had preventative vaccine for pertussis? This vaccine was approved back in 1948. During that time, prior to the vaccine, the case rate for pertussis was over 200,000 cases a year. The most common complications that can result from acquiring pertussis includes apnea and pneumonia. So what constitutes an occupational exposure to pertussis? Remember that this is a droplet transmitted disease. So droplet diseases require contact with oral or nasal secretions of the source patient, and that those secretions come into contact with mucous membranes. Also to be evaluated, close face-to-face contact without the use of a protective surgical mask. Our primary course of treatment for pertussis is azithromycin, Z-Pak, 1 dose a day for 5 days. Now, erythromycin was used pretty much in the past. It was given in 4 divided doses for 14 days. But this was substituted with Z-Pak because erythromycin sort of resulted in GI disturbances for many individuals. So primary choice is Z-Pak. So let's do a little summary about what we've discussed so far in this session. Number 1, we want to stress the need for vaccination for healthcare personnel. Yes, you can sign a declination form. Remember, declination forms do not remove any protections for you, say, for work comp. They are an important document to show that the employer offered you the protective vaccine as they are required to do. We are to use standard and droplet precautions when transporting, caring for an individual suspect for or diagnosed with pertussis. Droplet precautions only require a surgical mask, and that mask should be placed on the patient. If there's a lot of coughing and we can't mask the patient, then we will the care provider will wear the surgical mask. Hopefully, rapid diagnosis will take place, and we will get individuals who have been exposed started on post-exposure treatment. If they have no signs or symptoms, no work restriction is needed. However, if the exposed employee becomes symptomatic, then work restriction will need to take place. That brings us to the end of this discussion on pertussis, whooping cough. I hope you've received some helpful information. If you would like more information or have any questions, please feel free to contact me either by phone or email. Thank you all very much for your time and attention. I hope you'll join me once again for Let's Get It Straight.